Measles is an infectious viral disease causing fever and a red rash on the skin, typically occurring in childhood.
Mumps is a contagious and infectious viral disease causing swelling of the salivary glands in the face and a risk of sterility in adult males.
Dysentery is an infection of the intestine resulting in severe diarrhea.
Typhoid is an infectious bacterial fever with an eruption of red spots on the chest and abdomen and also severe intestinal irritation.
Some of the medical procedures during the Civil War was that they would amputate people's limbs if necessary, and they would have people inhale anesthesia if they were in a lot of pain.
Mumps is caused by a virus called rubella virus. Measles is caused by a rubeola virus. Dysentery is caused by the bacteria called Shigella. Typhoid is caused by the bacteria Salmonella typhi.
Bacteria played a major role in the loss of soldiers because if soldiers had open wounds, then they would easily get a disease due to not having any antibiotics back then. Also, they didn't take showers, and so they would pass the diseases to one another a lot easier.
Life-saving amputation, amnesia inhaler, closing chest wounds, facial reconstruction, and the ambulance to emergency room system.
The first antibiotic was penicillin.
Fleming was growing bacteria on some of the plates, trying to find ways to destroy bacteria. He came back to his lab with some of the bacteria having mold on it, which had been said to have saved lives.
The first scientist who discovered the first antibiotic was Alexander Fleming.
Penicillin is important in the medical field because it allowed physicians to treat severe and life-threatening illnesses such as meningitis, pneumonia, and syphilis. During World War II, penicillin had helped reduce the number of deaths and amputations of the soldiers.
World War I helped promote the discovery of these antibiotics by collecting a sample of bacteria taken from a soldier who had died of dysentery, proved why antibiotic resistance is so difficult to tackle.
It was used as anesthesia to reduce the torture and trauma of the surgery procedures.
It had a huge impact on people because without penicillin, many of the soldiers would have died while trying to be saved.
An antibiotic that was discovered after penicillin was streptomycin. The bacteria that it killed was tuberculosis.
In 2006, hand hygiene became a common practice in the medical healthcare system because in 2006, guidelines on hand hygiene in healthcare was published.
Hygiene is important in reducing the bacteria and virus infection because it prevents you from spreading germs to other people. According to Science Direct, there has been 7 hospital-wide observational surveys in Switzerland. They said that they have observed more than 20,000 opportunities for hand hygiene. Compliances have improved progressively from 48% in 1994 and 66% in 1997. Hand hygiene improved significantly among nurses and nursing assistants, but remained poor among doctors. The result was unchanged after adjustment for unknown risk factors of poor adherence. How to wash your hands properly is wet your hands with warm water, apply soap and wash well for 15 to 20 seconds. Rub hands together rapidly across all surfaces such as your wrists, the back of your hands, between your fingers and under your fingernails. Rinse well under running water, making sure all soap is removed, and then pat your hands dry with a towel.
Hand hygiene is also important when gardening and to prevent a buildup of ingrained soil or scratches before preparing food, before eating, after using the bathroom, after handling with animals, and after being around sick people.
Antibiotics kill the bacteria by causing the cell wall to disintegrate.
Antibiotics are important in our lives today because they can save our lives. They fight bacterial infections or they keep them from reproducing.
Cephalexin is used to treat infections such as urinary tract infections and sore throat. Levofloxacin is used to treat infections such as urinary tract infections, chlamydia, bacteria infections.
Tetracycline is used to treat infections such as acne and gonorrhea. The gentamicin is used to treat severe or serious bacterial infections such as inflammation of the heart. Clarithromycin is used to treat infections and ulcers such as sinus infections, stomach ulcers, tonsil infection.
Other precautions we can take to prevent bacterial infections are avoiding touching eyes, nose, and mouth, avoid contact with wild animals, clean or disinfecting counters or surfaces, and wearing gloves.
Lactobacillus, bifidobacterium, and Bacillus coagulans. Lactobacillus is found in fermenting products such as yogurt. Bifidobacterium is found in fermented foods like yogurt and cheese. Bacillus coagulans is found in soils and possibly in many foods. Lactobacillus benefits humans because it can improve your digestion and enhance your health. Bifidobacterium benefits humans because it helps your body develop your immune system. Bacillus coagulans benefits humans because it can boost the immune system by making it stronger to viral infections.
Antibiotic resistance is when an antibiotic has lost its ability to effectively control or kill bacteria growth. It can quickly spread to others, which would threaten the community with a new strain of infectious disease. Bacteria is becoming resistant to antibiotics because of the constant use of antibiotic or the proper use of the antibiotic, in which when a person takes an antibiotic, the sensitive bacteria is killed, but the resistant germs are left behind to grow and multiply. Do not take an antibiotic for a viral infection like the flu and the cold. Do not take antibiotics prescribed to someone else, and do not save some of your antibiotics for the next time you get sick. Genetic mutation and requiring assistance from another bacteria. It has not yet been proven that antibacterial containing products prevent the spread of infection is better than products that do not contain antibacterial chemicals. Hand soap, hand sanitizer, hand lotion, toothpaste, disinfectants, detergents, mouthwash, and garbage bags. Staphylococcus aureus and Enterococcus. Staphylococcus aureus is dangerous because it may cause blisters, abscesses, redness, and swelling in the infected area. Enterococcus is dangerous because it can't be controlled by antibiotics. It transmits the resistant genes to other dangerous bacteria. It's also dangerous because it causes life-threatening infection to people with dysfunctional immune systems. Bacteria spread so readily because they are one-celled organisms which can reproduce by splitting themselves in two halves. You can control this problem by waiting a few days without being prescribed with any type of antibiotic. It will be more of a problem because we won't be able to stop bacteria with the antibiotics we have, and many will die or get infected if exposed to these antibiotic-resistant bacteria. We are the problem because by us all sneezing and coughing, we spread infections, and the bacteria or virus that is produced are passed on by touching or shaking hands with other people. Avoid close contact with others, stay home when you're sick, clean your hands, and avoid touching eyes, nose, and mouth. Probiotics have a role in preventing drug-resistant infections because they can help fight off infections, and they can also help protect against the growth of harmful bacteria in the intestines.